Welcome to Brainstorms, Functional Neuro Rehab for SLPs, presented by SpeechTherapyPD.com. This podcast is designed for the adult medical speech-language pathologist. Most of our audience members work in settings such as acute care hospitals, private practice, outpatient hospital clinics, and inpatient rehabilitation hospitals. Each episode has an accompanying course on SpeechTherapyPD.com and is available for 0.1 ASHA CEUs. The content of this course is based on the research and experience of the presenters. The listener is responsible for researching to determine if the information and skills taught are appropriate for their clients, students, or patients. SpeechTherapyPD.com does not necessarily endorse, recommend, or favor the information shared, nor any of the claims, opinions, statements, offers, or services made by the presenter.
Hello and welcome everyone. My name is Renee Garrett and I'm your Speech Therapy PD podcast host for Brainstorms, Functional Neuro Rehab for SLPs. Before we get started, we have a few items to alert you to. Each episode is 60 minutes and will be offered for 0.1 ASHA CEU. Here are the financial and non-financial disclosures. Dr. Tabia Pope receives a salary as a clinical instructor at the University of the District of Columbia. She receives compensation and intellectual property rights from Head to Speech Incorporated and the Academy of Certified Sports Speech-Language Pathologists. She receives compensation from Speech Therapy PD for hosting a podcast mini-series and for participating as a podcast guest. Her non-financial disclosure is that Dr. Pope is the chairperson and board member at Head to Speech Incorporated. My financial disclosures are that I am a paid employee of a private consulting firm in the Commonwealth of Virginia, and as the host of Brainstorms, Functional Neuro Rehab for SLPs, and other webinars on Speech Therapy PD, I do receive financial compensation. My non-financial disclosure is that I am the secretary for the Communication Disorders Foundation of Virginia. Now, without further ado, we welcome our guest, Dr. Tabia Pope, PhD, CCC-SLP, Certified Sports SLP, who is a 3-time alumna of Howard University's Department of Communication Sciences and Disorders in Washington, D.C. Dr. Pope specializes in traumatic brain injury, sports concussion management, neuropsychology, and health communications. She has been nationally recognized as an invited speaker and author on topics ranging from health literacy and social marketing to interprofessional collaboration, workforce development, and business practice management. Dr. Pope is the founding president and CEO of Head to Speech Incorporated, the nation's leading nonprofit organization dedicated to athlete brain health, sports concussions, and their effects on speech, language, hearing, and cognitive communication skills. The mission is to promote athlete brain health by closing the gap between athletics and communication sciences and disorders through 4 pillars: bridge, connect, integrate, and expand. She developed Head to Speech's Career Pathways program for workforce development in athlete brain health and sports concussion management as part of the 2023 cohort for the ASHA Leadership Development Program. Head to Speech holds an open house and networking event during the ASHA convention, which is focused on building partnerships with individual faculty members and students, as well as leaders from associations, universities, organizations, and businesses for recruitment, curriculum development, and career advancement opportunities through a diverse pipeline from the speech and hearing clinic into athletics, sports, and fitness. In 2024, she founded the Academy of Certified Sports Speech-Language Pathologists, an online educational community and certification program that applies evidence-based professional development, service delivery, and business and practice management standards to athletics, sports, and fitness. The designation distinguishes SLPs who work in athletics, sports, and fitness. Dr. Pope is also a distinguished clinical instructor of speech-language pathology at the University of the District of Columbia and is one of the coordinators of the Brain Lab. She enjoys advising students on how they will work on interprofessional teams to obtain experience in brain injury by using clinical education, simulation, research, technology, community outreach, and industry-based experiences. She teaches master classes on the Head to Speech Ambassador podcast and mentors ambassadors in creating episodes that raise awareness within their communities. Her On the Neuro podcast series and Return to Learning After Sports Concussion presentations through speech therapy PD have gained 5-star reviews. Her article, Brain Health Prehab, was featured in the 7th issue of Significance in Athletics and Sports magazine. She's also been featured on NBC, CBS News, Fox, Field Goals for the Focus Driven Athlete podcast, and several sports and brain health platforms. Health and player safety is of the utmost importance to her family. She's the wife of a retired international professional basketball player and the mom of 2 boys who are active in sports and recreational activities. She serves on the Leadership Council for the Sports Philanthropy Network, Washington, D.C. chapter. Welcome, Dr. Pope. So nice to see you.
Thank you so much, Renee. Thank you so much for having me. And wow, that's a journey. I've been on a journey, and I'm so here with you today to talk about the importance of this conversation of workforce development, career pathways in this area. It's so needed. It's such an important conversation.
Yeah, well, and I know this is not technically on the agenda, but I didn't realize that you started this whole certified speech language pathology as sports concussion. Kind of, can you walk us through as sort of an intro and tell us about that?
Yes. Well, it's up and coming. It's up and coming because it's needed. I took all that I have gone throughout my journey of the do's and the don'ts, the how did I do this right, what worked, what didn't work, and really putting it into an academy that provides sports speech pathologists with a distinguished pathway that they can learn how to apply what they learn in neuro, but going beyond that in sports, right? So that area is not really tapped into in graduate programs. So it's a continuation of what you learn, but going beyond that specifically for the sports population. There's so many things that the nuances of sports that we have to talk about that's different from a military population and athletic population is going to be entirely different. And some of the things that we can pull from the military population can be modified for the sports population. And so I talk about the modifications, the dynamic assessments that are needed for the athletic population. How do we talk about this with the athletic population? What areas, assessments, and treatment, but also going beyond that, and how do we advocate going beyond that a little bit more than just assessment and treatment. So it's business practice management. Is how do you really be successful as a certified sports SLP?
Well, yeah, because we have the opportunity to have different certifications now, but like you mentioned, our neuro programs really sort of touch the tip of what we need, sort of like this iceberg, really, if you think about what we sort of see above the surface and everything else that's underneath. And that leads me to kind of talking about, what made you want to specialize in this particular area? Because I know for me, I started out working in inpatient rehab and I worked a lot with stroke patients, but I started really being intrigued by the TBI population and spent a lot of time working with just that population. And stroke is, of course, acquired brain injury. That was sort of the 2 things that I was really focused a lot on really early in my career, which led me to getting the certified brain injury specialty. But it's still, that is a certification that's test-based. It's not necessarily, you do have to prove that you have some experience working with the population as far as number of hours, but it really, again, there was no coursework that prepared me for what I needed to do next and how to apply that. So is that similar to your journey, or, kind of talk us through what your reasons, your why behind this are?
Yeah, so it really started with my own personal connection with concussion, my own history with concussion, and just that journey to understanding the things that I needed to be successful, right? And so that translated into my passion for traumatic brain injury. I knew that when I wanted to become a medical speech pathologist, this was the area that was for me because I loved the functional treatment. I love that we could talk about high functioning individuals that have had a brain injury, that need accommodations, that need to learn how to advocate for themselves, that need to be able to know that they have an invisible injury, and that how, and how to communicate that to other people was very important, right? So the functional treatment was really the basis of, okay, what do I learn more about traumatic brain injury? But then as I took a traumatic brain injury course, it was a seminar course, and I was able to actually choose a topic that I was passionate about to actually present to the class. And so from that allowed me to think about, well, what do I want to specialize in traumatic brain injury, right? Because traumatic brain injury is such a broad area, right? You have
Right.
TBIs by fall, domestic violence, military populations, blast injuries, right? So you have car accidents, right? So you have sports. So there you even have, dysphagia, you have the acute phase. So you think about all of this broad area, and then you have to break it down. And so I had said, well, my husband played basketball. I have seen how TBI and concussion has impacted athletes. And I watch sports all the time. And I'm like, what is my profession doing about sports concussions? And that's how it started. It literally started that way of me starting to do a lot more research. And during that time, I might date myself a little bit, but during this time was 2000 and 2014 when I started my doctoral research in this area. So there was not a lot of research at that time. You had a lot of you started to see the role of a speech pathologist, right? The research that was out there was, hey, we have a role in this. We need to work with athletic trainers that we're setting up at the collegiate level with interprofessional education and collaboration and integrating that way, and talking about the concussion protocols that were out. But that was really how it started for me. But then I had to think about, well, what is my passion, right? My passion, what do I want to, what type of mark do I want to leave in this area? Like, because I have to be able to also, be able to communicate my passion. And my passion has always been also health communications. I thought that I was going to be a broadcast journalist one day. And so I took my love for health and communications and bridged the two. So when I was doing my I was taking my cognate courses, I took them in neuropsychology and health communications. And that was just an aha moment for me, because I was able to think about how we could educated athletes and athletic population about this issue, right? And that wasn't really being talked about. It was kind of like concussion was a bad word to use, right? No one wanted to really talk about it. And so I had to learn how to talk about the issue without I would say not offending someone, but without, not having all this red tape around the issue, right? So I started to learn. My research focused on how to explore the knowledge and attitudes of athletic trainers, coaches, and players. And from there, I was able to understand what their learning needs were. Right. And so that goes into health literacy, because if you are trying to educate a population about their own health problems and getting them to understand the transfer of knowledge and the health benefits and all of that, you have to learn how to educate them, what's out there currently, and how you can kind of modify that. So from that, I mean, I really thought about expanding the scope of practice because we were focused heavily on. I just think our a lot of what we're taught in graduate school is obviously assessment and treatment, right? That, and you may get a good counseling course in there. You may get, you may get a private practice course if you're lucky. You may get a TBI course. You may get specialized information, depending on who your professors are. But the basis of it is, assessment and treatment. But we don't talk about the communications, the health literacy, the social determinants, right? We don't talk about the health disparities. We don't talk about the cultural responsiveness enough, the cultural humility, how learning styles are different, right? And
Right.
right, but those things that are within our scope of practice, right? The advocacy, the community outreach, all of those areas was what I wanted to focus on.
Mm-hmm.
So that is and that's how I literally started Head to Speech as an awareness campaign, and it transformed into a nonprofit organization, Head to Speech.
Yeah, that's so, I mean, the work that you're doing is just incredible. And I can understand sort of that journey because my husband is retired military. And so that was one of the reasons too, the area in which we live, I'm pretty close to Norfolk, largest naval base in the world, but we also have 3 other bases here plus Coast Guard. So we do see a lot when I was in acute care and in IPR, we saw a lot of military vets or active duty military across different military branches who had gotten in car accidents or motorcycle accidents, or I have had some that had a TBI as a result of a motor vehicle crash, but also had prior blast injuries overseas. And so that for me is kind of perpetuated because again, you're talking about a specific community and their needs are markedly different. And it's a place where I would say, I'm going to guess, but I would say for your specialty and what I've focused on, there's a lot of stigma surrounding mental health and how we don't talk about that. And if we pretend like it's not happening when it's not, and that's been a real drive. And actually, it's kind of funny because yesterday I have one of my very first TBI patients who was active duty military. We still keep in touch. His journey was long and there was a lot of navigation, like you said, advocacy, trying to advocate to help them find resources even after they were not seeing me in inpatient rehab, but I had access to things that they didn't. And so he's been able to he was actually a podcast guest a few months ago, but he talks about his journey. He's actually accomplished quite a few things, but it's been a journey. It's not easy. And it's just watching the struggle that still happens now. He's 13 years post injury. For the most part, like you mentioned, functionally, he does well. But what I think the bottom line is, and I think this is kind of where you and I connected, at least in my mind, the most was talking about how, yes, you might get lucky and have like a 1 hour seminar in TBI, but it misses a lot of the things that we as clinicians need. It focuses on what assessments do you use, and I think most of us have moved towards this model of including our patients and their caregivers in goal setting, in making sure they have the educational supportive things like like you said, health literacy, but making sure that those written pieces of paper or digital documents we're providing are written at a place that they can understand and that their caregivers can understand, because not everybody is the same. We see a wide variety there. And so when we're looking at sort of this curriculum that's needed for TBI, where would you say that starts? What would you think where that needs to go? Where does it need to start?
Yeah, I think that when we think of the curriculum, we have to think of the continuum of care that we provide, right? Because a lot of the research is currently in concussion is assessment, treatment at the high school collegiate level,
Mhm.
looking at rehabilitation, looking at interprofessional education and collaboration, and looking at the outcomes of like cognitive communication and the screenings and the assessments and the referrals and the lack of referral, right? Because the lack of education on the provider side, on the physician, the athletic
Yes.
trainer, those that are first line responders, and their lack of knowledge of our role in concussion, sports concussion management, our role, and that they're not referring or don't have the appropriate tools to refer to us so we can see the athletes earlier, right? For
Mhm.
earlier identification, earlier education, earlier getting in there earlier, prehabilitation, working on more cognitive, neurocognitive training than the rehabilitation, right?
Mhm.
And so I think of the continuum of care. So when we look at the curriculum for TBI, I'm thinking, let's just take an example of a graduate program that may have a neuro course, and that course stuffs in right hemisphere, TBI, aphasia. They're talking about all of the neuro disorders in that one course. But I challenge programs to think about how they can have a course that talks about traumatic brain injury. And you remember, even if you have a course that talks about traumatic brain injury, just similar to the certified brain injury specialist, it's broad.
Mhm.
Comes to TBI, right? TBI in itself has has this broad window. So you truly need a standalone course that's just for sports concussion management.
Mhm.
Because even in sports concussion management is going to give you an overview of everything that you need for sports concussion management. And so I think that that's how we have to think about the curriculum that we are providing our students and how we can provide them with fill in the gaps for them, right? So the gaps don't have to be necessarily a standalone course. It could be an elective course. It could be an industry-based experience. It could be a simulation. It could be a case study. It could be utilizing technology. It doesn't necessarily have to be, if it doesn't fit into your curriculum, you can still find a way to fit it in there some way, right? And being creative with how you deliver the information. You could bring, someone like myself who has the information for sports concussion management and actually go through this information with your students, right? As a lab, right? Or
Mhm.
as a guest speaker, right?
Sure.
So that curriculum, you have to think about, do we have the infrastructure, right? Because I also look at the infrastructure. So we have, say your program, where is your program housed? So if you have a program that is housed with athletic training, you may have physical therapy, occupational therapy, you may have nursing, you may have all of these health professions that are housed in the same division as the speech pathology program or communication sciences and disorders program. That
Mhm.
is the ideal infrastructure for interprofessional education and collaboration. Because if you don't have the curriculum, at least you have the infrastructure to do a weekend, something on the weekend, or something during the week that brings all of the professions together for IPE, right? But if
Mhm.
you
Yeah.
don't, but if you don't have that infrastructure, then that's where I help to bridge that gap, right? Because you may have a bridge already with that infrastructure, but then you may not even have a bridge, and we have to create that bridge for you, right? And that's how I look at it. It's like, how do we bridge? So if you have that infrastructure, great. Are you all doing those things at your university? How are you doing those things? What's working, what's not working, and how are you advocating for other programs to do something similar, right?
Yeah, because you can totally do that by reaching out to your colleagues at a different university. And like you mentioned, some really great points about guest speaking. I've done a course on TBI well, it's really on post-concussion syndrome. I've done that for a couple of years now, just a 1 hour guest at University of Southern Alabama. And it's virtual. It's, a way to share and grow, but the students get the neuro piece in their class, they get the theory behind it, and then they hear someone with a lot of clinical experience talking about what that looks like, not just what your brain does. Because I think it's hard for students sometimes to translate that. I know it was for me. It was like, oh, this is great. I know I have all this knowledge, and I might remember, the reticulating pathways and things like that, different neuro connections in your brain. But the big thing is translating it.
Yeah.
We learn all this theory and stuff, and then we don't know what to do with it later.
Yeah, and I think one way to actually help with the transfer of knowledge in that translation is really thinking of your student population, right? So you may have an undergraduate program in communication science and disorders. You may have a master's program, and you may have a doctorate program. Some programs may just have only the undergraduate. It depends on your infrastructure, right? So if you have all three offerings, or if you just have one or two offerings, then you want to think about what your student population looks like. So you may have undergrads in your program that are athletes, right?
Right.
So
yeah, I've had a ton of those.
Right. Yeah. So you have athletes in your classes that can help with the transfer and to help with make that connection. There's a sense of belonging here that it has not been tapped into and connected in a way. And that's what I'm trying to do with Head to Speech, and the things that I'm doing with the Certified Sports SLP is making those connections of a sense of belonging that, hey, we have this infrastructure here at this university. We need to maximize it. How do we maximize it? How do we utilize our students that are athletes to transfer this knowledge, to do these simulation experiences, to do these industry-based experiences? And one of the things that SLPs always tell me is that they need to build confidence. They're not confident in treating the athletic population. So just because, we think about our clinical fellowship, right? That is supposed to be the bridge for us clinically to really build those clinical skills before we're on our own. And that has to happen with sports concussion management. There has to be that bridge there that can provide hands-on training, hands-on support that can help you build your confidence in this area before you're on your own. And that's what I have developed, is that bridge there to help you build those skills and that sense of belonging. But there have been programs out there that have talked about sports concussion management, either giving the clock hours in the program that are dedicated clock hours towards sports concussion management. So, making sure that if you have the clients in your clinic, they're going to be athletes. They're going to, you're going to work on sports concussion management, and there's a certain amount of hours that you have to get in that area to be, to get a certificate in that area. So there are ways for you to implement this. It doesn't necessarily have to be a standalone course, or, it could be clinically too. It could be part of the clinic.
Yeah, no, I think that would be great. I want to sign up for that. Because, again, another really great point that you mentioned was that TBI is very broad, and it does really vary. And your 65-year-old who had a fall and now has a TBI, their life looks very different than a 25-year-old athlete who fell and hit their head on the court, or, our professional and collegiate football players who take a big hit. Or even there's a lot right now in the media about cheerleaders and requirements that they're changing for being more mindful about the risk of falls and the risk of it's a contact sport. You're building pyramids and doing all sorts of other things with tumbling. And I know even for my son was a high school swimmer, I can't tell you how many times we've seen somebody smack their head on the concrete wall in a flip turn. And that's, again, you're looking at a different life need for that student
Yeah.
versus a professional athlete versus a collegiate athlete. And so,
Yes.
kind of what are our recommendations as far as ASHA goes? What do they look like? Do we have anything specific regarding sports concussions? Because I haven't seen it.
So it's interesting to make your point with the swimmers too, because yes, cheerleading for so long, it was thought that cheerleading was not a sport, right? And they get forgotten about when it comes to brain health and concussion management. That's untapped population even within sports. And then swimmers. I just was on a call the other day talking about swimmers protection and
Mm-hmm.
headgear that is now developed to prevent brain injuries in the swimming population, aquatic sports, right? Aquatic sports. So it
Yeah.
just, and how frequent it is to have but it's different. It's a different type of concussion and how it's
Yeah.
sustained, even within the athletic population, right? So that's what I say, even with the athletic population, you have to understand how each group or each sport, how concussion is impacting them differently, right? Because when you think about lacrosse, you think about the women's lacrosse, they don't wear headgear, but the men do. I don't understand that. But it's so you think about those things, right? But when it comes to what's out there, the information and where's this information coming from? For the longest, the information when I started was coming from the CDC, the
Mm-hmm.
Heads Up campaign. And so that has been the longest standing protocol for responding to sports related concussion. That, it provided education, different education. It was focused on youth sports. It wasn't necessarily focused on collegiate or adult sports. And then came along USA football and came along some other foundations that specifically talked about CTE and talked about the pro concussions, right? And pro professional athletes. But that for the longest was the Heads Up. And so as I was developing my own campaign, Head to Speech, that became a nonprofit organization, the tools that I was developing was specifically looking at the collegiate population and the young adult population and the adult population, like pro athletes, and then as they transitioned out of sports, right? So I knew that there was information out there on like I said, a lot of the research is in the high school and collegiate space. And so what I'm doing now, my research is really focused on moving out of the collegiate space and moving into the professional space, moving beyond that, because that's where the largest gap is there really isn't anything out there right now in research, and so that is an area that's a need. But when I look at ASHA, we look at, there's where are the CEUs pretty much coming from in this area. We look at ASHA's, CEU site, the Brain Injury Association of America. They have updated their materials to include some sports concussion management, but it talks about return to play and return to learning, but it's not even in depth as something I would do, and that you would come to me for Head to Speech. But you have other platforms that have talked about it. You have other university concussion management programs out there. One of the ones that comes to mind is the Miami University Concussion Management Program. I know that there's also concussion management happening at East Tennessee State University, University of District of Columbia, where I am, the University of Texas at El Paso had a certificate in concussion management. And then you have nonprofit organizations such as Head to Speech. But when we look at ASHA's recommendations, a lot of the information is coming from the ASHA leader, has come from the ASHA journals. And some of the titles that stood out to me were, the management of sports-related concussion in children and adolescents, traumatic brain injury in adults, summary of clinical practice guidelines coming from ASHA. ASHA has a statement from the American Medical Society for Sports Medicine position statement on concussion in sports on their website. So they have taken their position statement and has put that on the ASHA website. Continuum of care following sports-related concussion is another article that I found on ASHA Leader. And then ASHA is involved in the concussion, the National Concussion Awareness campaign, the Concussion Now campaign. And so that is that's a campaign that has several associations involved with that campaign that talks about concussion awareness. And so those are the things that I have been keeping up with when it comes to sports concussion management and keeping up with the trends in this area. It has evolved, but now I say, okay, we have the literature that shows that we have a role. Now we have to expand that role. We have to make it so all of the programs, speech pathology programs, are doing something similar. There's some standardized process that's put into place when it comes to curriculum development in this area. And so we're not doing, we're putting ourselves, we're doing a disservice if we're not doing something standardized, because then we don't understand what each program, what our students are getting and what the needs are and the lack of knowledge and education.
Well, even from a scientific standpoint, if you're not, if you're changing it every single time, you're not going to have good statistics and good knowledge of what's working and what's not working. And I think a good example of that, and this is how my functional brain works. If I had invented the card reader when you go to check out at every store, we could just have that all be the same. So you didn't have to say, push the green button or push the red button. Well, for those people to really get another layer and talk about social determinants of health, my husband is colorblind. So when they say push the red or push the green, he's like, I don't know, I can't tell the difference. So you're going to have to say X or O or plus or minus or whatever. So if you had one standardized thing, everyone would know what to do. And I think that's probably a really simple way to understand it, because I know for me, I go to a couple different grocery stores and it's like you put your card up there and then what happens next? We don't know what to do. We have to ask somebody for help. And I think that's a really good correlation, because we don't always know what to do. We've got some, like you mentioned about swimmers, and I'll use that example again. I know my son, even in high school, they were doing, and I can't remember the name of the program because he's getting up there. No, I'm not. He is. They did a program that was a computer based. It was actually on a tablet, and they went through a series of questions, and they did it before the season and they did it postseason. And then that way they had this measure from from preseason and postseason. And if anything happened in between those 2 points, they could ask the questions and see what the kids or teenagers were answering. It's similar to the things that they use on the sidelines for their screening protocols with the athletic trainers. But again, it's not necessarily standardized. There's different programs that you can use, and it's really based on what the team selection is or what the league selection is.
Yeah,
so,
even with concussion management protocols, NCAA, for example, there is a mandate that you must have a concussion management protocol, but the way in which each athletic department implements that protocol may be different. And so even within sports concussion management, right? So it's hard because you have a protocol, but then it's not standardized. It may not be standardized, and it shifts, and it's based off of different things, right? Different, and in sports, there's a lot of conflict of interest as well when it comes to, making sure that where you are on the totem pole, I guess, of, athletic ability, who gets through that protocol faster, right? And so we want to make sure that speech pathology, one of the things that speech pathologists ask me is, well, when should I be working with athletes, right? And I'm always like, well, we need to be working with them immediately, right? And we shouldn't be going in 21 days post, until when they're having difficulty with return to learning, but we should be working with them baseline, getting an accurate baseline for understanding who they are before the season, working with them during the season, even without injury, right? So this is without injury. And if they have an injury, you already have a baseline, you already have a rapport with them, and then you can work with them with rehabilitation. So it is so important for you to advocate for this earlier timely identification, preventative education, working with them earlier, and not just athlete, but those around them, for those relationships, right? And so when something does happen, sports can be very reactive. I think we talk about mental health, right? And I try to really bridge that intersection. So I say the intersection between brain health and mental health, because if you don't understand the brain health of the athlete, then you're going to miss those signs and symptoms. You're going to miss the opportunities to advocate and prepare that athlete to talk about what's happening with their brain health, to build them up with accommodations, to build them up with strategies, to build them up with the counseling, what to do, the terminology. Then if you build them up, hopefully it will decrease the mental health and the stigma, because now they are armed with the knowledge to be able to navigate. I'm not as depressed. I have these feelings, but now I know how to navigate feelings, right? And so hopefully that decreases the mental health issues that are stem from the brain health. But what's happened is that we haven't focused, and I say athletics, when I say we, the athletic community has not focused on the brain health enough to empower everybody that's in that space to say, hey, it's okay to talk about these strategies. Hey, it's okay to utilize these strategies when it comes to remembering these plays. It's good to know my learning style. So when my coach is trying to teach me these plays, I can tell them my learning style, and I can understand it a lot better. Oh, I can integrate this into my learning the plays. And then it translates into, I'm already doing that. And then something happens, I'm utilizing that information for learning in the classroom, right? So there has to be the translation there with, what are you doing on a day-to-day basis? What are those missed opportunities that we're just not capturing there when it comes to brain health? So we're already doing it. So when something does happen, we're being proactive instead of reactive to what the player's needs are, because that's going to cause depression, suicidal behaviors. That's going to cause, all of the mental health issues if we don't address the brain health.
Yeah, and I think that's a great piece for when we talk about community education as a whole, because that's also something we see in our patients with stroke. I can't tell you how many times I've gone into a room and, found even my own dad, when my dad was still living, when he had his first stroke and he's in this room and he's crying. Never seen my dad cry ever. I was 25 years old. And having someone acknowledge that this is a normal part of your brain's reaction chemically and physiologically to what has happened to you, and it's not your fault. I think if people knew that more, like you said, instead of as a reactive component, but a proactive component, I think it would cut down a lot on the mental health, not only issues, but that stigma. That's just my soapbox. I'm a big fan of, feel like we don't do a very good job with community education as a whole medical community, not just speech language pathologist.
Yes. And as speech pathologists, we actually have more time to focus on that education than, say, a
Mm-hmm.
physician, right? We're
Yeah.
really patients for a long period of time compared to other professions. And so if we take that approach has to, be part of our toolbox to be able to, to educate our especially this population, the athletic population. But same goes for stroke population, neurogenic disorders in general. Yeah, the medical
Mm-hmm.
population.
So let's jump back into the workforce development piece, because I think it's so interesting to me, and I'm learning from this as you're talking too. And I just think that having this, like you said, it's much needed, this role of SLP and career pathways into the sports concussion, the purpose of that, and how do we sort of get, we think of it as our students, but what if you're a seasoned clinician and you decide that maybe this is something that you have, it's not been tapped into, but you're interested in it? How
Mhm.
would one go about breaking this down and getting it more involved? Gaining
Yes.
competency. That's it.
Yes.
That's the word I
Yes.
was looking
Yes.
for.
Gaining competency. Yes. That has been one of the biggest challenges, I would say, because I have seen the development of our role in concussion management and the lack of where can you go to get the information, right? The whole competency piece. And I had to create a lot of the tools that I use to educate. I've had to create because it didn't exist. I've had to kind of take and modify and develop. And so I finally have been able to have data that shows through the Head to Speech Interprofessional Task Force Summit that it works, that the framework that was developed, the interprofessional education pathway that has been developed has actually helped others with their transfer of knowledge, right? Of how this applies to what taking what they know in adult neurogenic disorders and how to apply it to the sports population. I would say if you are someone who's interested in this area, I'm here to help you. I'm here to help you. A lot of it is thinking about where the educational, if you look at the continuum of care, if you look at take if you're in an educational setting, if you're in the healthcare setting, or if you're in a private practice setting. So look at where you currently are in your setting. And then from there, look at how is sports and fitness tied to that setting that you're in. Okay. So say if you are a school-based speech pathologist, because I say school-based speech pathologist because for some reason, they don't think that they have a role. They may not think that they have a role in concussion management, but you do. So if you take
Yeah.
the educational setting, how is sports, brain health, sports and fitness tied into that educational setting? Is it the nurse? Who is the one responsible for brain injury and concussion? If a student comes and says that they're in the chair and they fall back, right? Because kids play all the time. They're in the chair and they fall back and they hit their head, or they're on the playground doing recreational things, on playing. They fall from the monkey bars and fall down and hit their head. They crash into each other, collide. They hit their head. They also play sports. There's so many Little Leagues and Pop Warner leagues out there now. So they're playing sports. So you can't say that kids, they're not athletes, because that identity as an athlete starts very early.
Yes.
Okay. So in the educational setting, who's responsible? What does that team look like at the educational setting? And how can you, in that space, influence the education, the training, the resource development, when it comes to talking to the administrators as well as the parents, right? And so how do you, and you have to do that. You may have coaches, because usually the coaches are also the teachers in that setting too.
Right. Yes.
So you have a math teacher who's the coach, the PE teacher, right? So those are the professionals that you're going to be working with that are on your team. Okay. And then in the healthcare setting, let's take the sniff, because people don't think about this enough. So if I'm in the sniff, usually we have the activities director who is helping with the activities. We may have memory care in the sniff, or we may have that type of information, and type of resources. You have the nurses, social worker, OT, PT, and speech, right? So you have the dietitian. So you have these professionals there in the sniff. So you may have, I know in the SNF that I used to work in, they had military veterans, like Veterans Day. They would go and honor the veterans in that space, right? In that setting, those that lived there that were residents. The same needs to happen for athletes. I don't know, that connection, sports and fitness. Hey, you may have a patient who is a former athlete that has played sports throughout their life. Have you asked them? And this goes back to the when we do our evaluations. Are we asking our patients, have you played sports and have you had a concussion?
Very true.
Okay. So even if you are, say, there are other SNFs I've worked in that had a population where some of the population had been incarcerated. Okay. So we know the research shows that those that also are incarcerated also have may have brain injuries as well. Okay. So if we're not talking to our population about concussion history and have you played sports and what sports have you played, this is part of reminiscent therapy. If you're working on dementia care, it's part of reminiscent therapy, right?
That's right.
Well, tell me about, you used to be a quarterback. What position did you play? Can you tell me, do you remember anything about the plays? Who were your teammates? What was your coach's name? Right? So you are now bringing in parts of their life into your care. That's how you can influence, how you can start to provide sports related therapy, right? That is athlete driven, that is within that space that you're in right now. It doesn't have to be, oh, I have to go to a whole nother setting, as in the sports arena, right? I mean, that's where we are now moving towards. But if you are someone that is in the SNF, someone that's in the educational facility, if you're in telepractice, right? If you are someone who says, hey, you know what, on my practice, I have a private practice and we're doing telehealth. Well, that's actually one of the best models to actually work with athletes.
Because you can meet them where they are.
There you go. There you go. So now you're thinking like, how do I increase access to care for athletes? Well, it's through teletherapy, right? Because their schedules are busy. If you're trying to tap into the current athletic population and you're trying to treat them, you're going to have to tap into some source of teletherapy model, right? Or that type of model. And so you have to learn how to tap into the population through where you currently are. And that's what I teach. I teach not only, yes, we want you to also, you may have desires to actually work in a sports arena, but I also teach speech pathologists to meet the athletes where they are in the current setting that they are in as well.
Yeah, I mean, we have, especially when you're looking at professional athletes, but now you're seeing it even more with college athletic programs. People are switching programs. They're moving from city to city. It's not, we're both on the East Coast and we've got quarterbacks that in the NFL that played on the West Coast 2 years ago who are now on the East Coast and vice versa. So
yeah, the transfer portal has shaken things up, right?
Yeah, especially for the college football programs.
Yes. And so, and that is one thing when it comes to treating athletes, right? You have to think about also athletes want, it's also, you want to become like the best kept secret in a way. Like athletes, want exclusivity, right? The
Mhm.
access to athletes, it's hard to treat athletes because there's limited access to them. That's why it's so hard to treat them. Right? But if you can create a pathway for yourself into sports, it's also, making sure that you are accessing those around the athlete to be able to provide those that are around them with the information to be able to access the athlete easier. Because if those around them don't understand the benefit, then you're not going to have access to the athlete, unfortunately.
Right. And if you're not using the teletherapy model and this athlete's moving from place to place, trainer to trainer may be different. Their coaching staff is different. The person who's doing the massage therapy or whatever after is, those are all, it reminds me very much of how when people would come to the hospital with dementia from skilled nursing, and the nursing staff or maybe somebody else on the multidisciplinary team would be like, well, good luck with that one. Well, they're not thinking about the fact that everything's different. The sheets are different. The lights are different. The clothes are different. The room setup is different. And so if you think about the athletes in terms of that, the locker room looks different. The place that they go to might be different. The stadium is different. All of the things that are part of their daily life when it comes to practice and, of course, games, everything is different when they move from place to place, and even including the professionals that they're dealing with who may not have a rapport with them. So they're not going to be as likely to disclose information about their mental health or prior things that they're concerned about as far as a sports concussion goes. It may be in their record, but maybe they're not looking at that. Again, I think that's a really good way to think about it when we think about our role, because I love a good a deep dive into a medical chart.
Yeah. Yeah. Yeah, and that's something that you have to ask. What is the concussion history? There is one thing that I did want to bring up when we talk about workforce development that I don't want to overlook is the recruitment and retention strategies, even within our profession, right?
Mhm.
So knowing that TBI is part of but how do we recruit and talk about this specialty to those that may be interested in coming into our profession?
Mhm.
And I want to talk about that because that's very important if we're going to expand the workforce, right, in this area, is looking at how do we recruit, how do we provide the pathway, a successful pathway for
Mhm.
those speech pathologists that are now interested in speech pathology and have to get the prerequisites. They may not have completed a speech pathology degree, but now, hey, I heard about this, and how do I get into speech pathology? We have to provide them with a clear pathway that talks about you have these prerequisites. This is a STEAM, right? They say STEAM now, not STEM, but STEAM, right? This is a STEAM career. There are a lot of programs out there that, want to focus on STEAM careers. So,
Mhm.
so tapping into those programs and hey, speech pathology is a STEAM career. We talk about science, technology, and so these are the things. Talk about the prerequisites, what they need, but then also talk about the pathway that they need to get into to be successful, to get through a master's program, to be successful, and actually how do they become specialized in this area, and when they get specialized, the specialization, how are they placed into a career in this area, right? And so that's what I have been focusing on is through the Career Pathways program at Head to Speech, is making sure that there is a clear pathway through those stages, and partnering with programs and partnering with those that have the infrastructure to actually put these this career pathway into place. And so that I'm very excited about that, because this work is going to change the game for speech pathology and how we recruit and retain students into our profession, to also diversify the field as well, right? Because you have I was a broadcast journalism major. I didn't know about speech pathology until my grandfather had a stroke. So it's not that it may be, who doesn't know about speech pathology in the of speech pathology, right? It may be that we are a profession that people just don't know about us. So what we do, right? And so if someone was to say, hey, did you know that you can connect your love for sports and speech pathology and become a certified sports SLP? Did you know that you could do that? That. And you give it, and we have created a clear career pathway to do that. And so that is what's important to me, is making sure that when we are recruiting, we're utilizing this as also a strategy.
Yeah, no, I agree 100%. I was a biology major before my dad had his stroke when I was 25, and same thing. I had no idea what a speech language pathologist was, much less he had issues with swallowing, and he had aphasia. So I didn't know what any of those words meant. And I was an honors student, and took a lot of AP courses and went to college and still had no idea what those words were. But
it's our title could be confusing too, because when you add swallowing, they're like, well, hold up, that's not in your title. You weren't, and then our identity is also, oh yeah, I work with a speech pathologist in the educational setting for fluency or articulation. And so even the thought of, oh, I didn't know I could work with athletes in this population, or I didn't know the sports and fitness world, right, was a viable option for me. I've had, when you talk about professionals that are currently in their profession and now maybe looking to transition into something different, I've talked to those that said, if I would have known what I know now and had met you and had this would have been something I would have went into, because I actually wanted to do, fitness, and I was, I have, my passion is in fitness, or now I'm a yoga instructor. Now I do other things in sports and fitness. I'm a sports mom. I'm a coach. The sports is very. You could be a speech pathologist and have different connections to sports, right? You could be like a speech pathologist, a sports mom, a sports wife. You can, you can watch sports. You could be a fan. It's so you have so many connections. You can have a kid that plays sports, right? So there's just so many connections to sports and fitness and brain health that it's like it's like, why did we not think about this sooner?
Yeah. No, and I agree. And I thank you so much for joining us, because I think this whole concept of brain health as a prehab is a really important point that you made. I think the whole thing was really great. So thank you so much for agreeing to do this. And certainly we probably could go another hour. But any last thing? Yeah, any last thing that you want to share with the audience?
Well, I really just want everyone to really think about utilizing the resources that are available to them if they are interested in advocating for the profession, if they are interested in actually understanding interprofessional education and collaboration, if they're interested in actually looking at what's available to them in a viable career path in this, and really reaching out to me and my organization, Head to Speech, as well as considering also the Academy for Certified Sports SLPs as a way to gain competency in this area as well.
Well, thank you so much for being here, and we look forward to seeing you again.
Thank you.
If you have indicated that you are part of the ASHA registry and entered both your ASHA number and a complete address in your account profile prior to the course completion, we will submit earned CEUs to ASHA. Please allow 1 to 2 months from the completion date for your CEUs to be reflected on your ASHA transcript. Each episode comes with an accompanying course on speechtherapypd.com. available for a 0.1 ASHA CEU. And just for our listeners, get $20 off any subscription with promo code BRAINSTORMS20. SpeechTherapyPD.com is run by SLPs for SLPs. We've got the largest library of ASHA CEU eligible courses out there, adding fresh content every week. Remember, use BRAINSTORMS20 to get $20 off access to over 1,000 courses for an entire year. Head over to SpeechTherapyPD.com for more information and start earning CEs today. Thanks for tuning in to Brainstorms Functional Neuro Rehab for SLPs. And don't forget, SpeechTherapyPD.com is your go-to for all things ASHA CEUs. Your positive reviews and support mean the world to us. We'd love for you to drop us a quick review and hit that follow button.